Another day and a new surprise in the president's health care law. According to the Wall Street Journal, many Americans could face sky-high drug costs under Obamacare. Congressman Burgess out of Texas and Congressman Dan Benishek out of Michigan, both members of the House Republican Doctors Caucus. And gentlemen, good morning to you. The article, by the way, points out that depending on the coverage you select and the medications you're on, some patients could be left with, a big case of sticker shock. Gentlemen, hello, and thank you for your time. I guess to Representative Burgess first, what about this story, and who needs to be concerned?
Well, it's a surprise, but it shouldn't be a surprise. Many people now are becoming acquainted with the concept of actuarial value. The bronze plans that were made available under the Affordable Care Act have a 60% actuarial value. Well, what does that mean in practical terms? It means that you, the patient, are going to be paying 60% of those costs. Look, I've had a high deductible health plan for 15 years. I understand what that means. But, Bill, I've never seen deductibles as high as the bronze plans in the individual market on the exchange. $6,800 for an individual's policy. I've never had to deal with a deductible that's that high. And then when you translate that to your prescription drug benefit, that means out of the cost of your prescription drugs, you're paying the first $6,800. That is a staggering sum for most people to contemplate. And look, this was all predictable. I mean, it's written in the law. It didn't need to come as a surprise, but no one has really discussed it before. So I thank you for bringing it to people's attention.
This is hepatitis, rheumatoid arthritis, HIV, and cancer. And Dr.
Bill, it's asthma drugs.
Keep going.
It's everything. It's asthma drugs. It's everything that you might take that costs more than just a few dollars in the over-the-counter market, everything on the prescription market. And I would just ask you, when has the massive infusion of federal dollars into a system ever resulted in the price going down? It just doesn't happen.
Dr. Benishek, you were relaying stories about what you're hearing back home in northern Michigan. What are you hearing?
Well, I've had hundreds of communications with the constituents around the district saying, how they had lost their health care plan, and in order to get anything comparable, it's going to cost them between 40 and 100% more than they were paying before. Frankly, as the president's health care plan rolls out, there's more and more higher costs that we're seeing. I've been opposed to the president's health care plan from the very beginning. As a physician, I realize what a disaster it is for American health care. Frankly, my biggest concern is the fact that the president's health care bill cuts $700 billion out of Medicare, and it's going to be difficult for rural hospitals such as the ones in my district to stay open and be viable and provide the access to care that people in rural areas need with those cuts.
Yeah, $700 billion from Medicare. It looks like $300 billion in addition from Medicare Advantage. That's $1 trillion, gentlemen, if that happens. Now, to both of you, what is the practical effect you believe on America starting in 2014? Representative Burgess first.
The sticker shock, sure, it's something we've talked about for some time. Again, I don't remember what the Affordable Care Act purported to do, and it was fix the problems in the individual insurance market. It's made those worse. And although there is a cap on out-of-pocket expenses written into law, remember that the president unilaterally suspended that, probably because the insurance companies came back to him and said, well, there's no way we can price the plans for next year in reality without this stop on the out-of-pocket expenses. So this thing changes, it morphs as it goes along. It was never ready for prime time, and unfortunately now Dr. Benishek's constituents, my constituents, Americans across the country are the ones who are going to suffer.
It's likely to change again. We'll all find out soon. Thank you, Dan Benishek and Burgess from the House Republican Doctors Caucus. Thank you, men.
Thank you.
Thanks, Bill.